Hello everyone! Welcome to the last module. For today's discussion, we shall cover the first part of promoting physiologic health. And it is particularly about activity and exercise, nutrition, and sleep. Activity and exercise. For the learning outcomes, at the end of this discussion, the students will be able to identify the various concepts of health and wellness models, define key terms, describe the basic elements of normal movement, enumerate the factors affecting body alignment and activity, differentiate the types of exercise, explain the benefits of exercise, assess activity exercise pattern and problems related to immobility, and develop nursing diagnosis and outcomes related to activity exercise and mobility problems. For the models of health and wellness, we have holistic model. Holistic model covers several aspects. We have physical, psychological, or mental, emotional, social, and spiritual. Its emphasis lies on optimizing the sense of an individual's well-being. For the physical aspect, when it comes to supporting the physical health, here are a few key practices that can make a huge difference in your well-being. Of course, we have having adequate sleep. Okay, which actually is for adults like 7 to 8 hours, and we'll actually discuss more of this on the next topic. Taking in nutritious foods, having regular exercise and activities, practicing healthy lifestyle. For the mental health aspect, this actually often overlaps with both our emotional and physical health. Okay, the big distinction between our mental and emotional health, though, is that while our emotional health refers mostly to our daily moods and emotions, our mental health refers to our cognitive abilities that affect our brain functions. On the other hand, emotional health is just as important as our physical health, especially because our emotional health can affect our physical health if it is not being taken care of or not prioritized. So, here are some ways which you can support your emotional health. So, we practice mindfulness and stress reduction habits. Okay, so we can also have a journal. Okay, and then if necessary, we can seek out for therapy. Okay, so it is okay to seek out for therapy or seek consultation should you think that you need that in your of course in your life. Another one is social health. Okay, so here are ways that you can support your social health. It is important that you spend quality time with family and friends. So you make time for in-person connection. Although technology allowed us to somehow feel connected, research has shown that virtual connection still does not provide us with the same level of happiness as in-person connection does. Another one is to get involved in the community. So either you can join organizations, volunteer in the church or in your barangay. Okay, so there you can support actually your social health. And next is to set boundaries with people that may increase stress. So again, do not be afraid to walk away from friendships and relationships that are negatively affecting one's health. For the spiritual health, spiritual wellness does not necessarily mean that you actually take note of the client becoming religious, although the two often have overlapping practices and principles. So instead, one's spiritual health should focus on how the individual is connecting with one's inner soul and the greater world around that individual. So here are some ways that we can support one's spiritual health. So, take time to practice your faith. Okay, so that could be, again, observing or finding out if the client goes to church, prays, okay. Also, encouraging or taking some opportunity to give and forgive. And then, for terminally ill clients, again, we have the readiness to depart in a peaceful and calm manner. Another model is called the iceberg model of health and disease. The iceberg model asserts that one's current state of health, be it disease or vitality, okay, is just the tip, okay? It's just the tip of the iceberg. Alright, so apparently, current state of health is what can only be seen. Alright, so other levels here, as you can see in this image, it's hidden. Okay, so these are, we have, for example, lifestyle or behavioral level. So what does your client eat? Are they exercising? How do they relax? How do they let go of stress? Okay, and next is we have psychological or motivational level. So what are they doing in order for them to be able to be motivated, to get to have more positive mental health and emotional health, okay? And for the spiritual being, what do they practice, okay, in order for them to improve their spiritual health? This actually cannot be seen. It's under already, and it's called, again, the iceberg, because, as I repeat, you can only see the tip of the iceberg. Either the individual is healthy or the individual is not well. Let's define some key terms. So, when we say health, according to the World Health Organization in 2011, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Activity exercise pattern is defined as an individual's routine of exercise, activity, leisure, and recreation. It includes activities of daily living, or we call this ADL, that requires energy expenditure. So, as simple as having or promoting hygienic practices, dressing up, shopping, working. Next, we have mobility. This is the ability to move freely, easily, rhythmically, and purposively in the environment. It is actually an essential part of one's living. Have you heard of range of motion? Range of motion is the maximum movement that is possible for a certain joint. Okay? So, range of motion, we also call that ROM. Another one, we have the proprioception. This describes the awareness of posture, movement, and changes in balance or equilibrium. Here, the individual has knowledge on the position, weight, any resistance to an object in relation to the body. Here are the basic elements of normal body movement. We have body alignment, joint mobility, balance, coordinated movement. So when we say body alignment, we mean to say that here, it brings body parts into a position that promotes optimum balance and body function. So, balance is maintained, okay, as long as the line of gravity, okay, passes through the center of gravity and the base of support. Okay, so for instance, in this illustration, alright, so the line of gravity is an imaginary line drawn through the body. Okay, so the center of gravity is the point at which all of the body's mass is centered here. Okay, and then we have the base of support. Okay, the base of support, this is the foundation at which the body rests. So, again, In humans, the usual line of gravity begins at the top of the head, okay, and falls between the shoulders, okay, and through the trunk, okay. So, slightly anterior to the sacrum and between the weight-bearing joints and base of support. What are the advantages of aligned body? Okay, it minimizes strain. It minimizes strain of the muscles, tendons, ligaments. Another one is it supports internal body structure. Okay, and you have, of course, it supports the organs, your liver, your heart. Okay, and then another one is it enhances lung expansion, and there you can actually observe for efficient circulatory, renal, and gastrointestinal tract functions. In terms of the joint mobility, okay, so let's find out. When we say joints, they are actually functional units of the musculoskeletal system. They can either flex or extend, okay? So, if the client or an individual does not exercise, the joint can be affected in terms of its flexibility. So, muscles can also shorten. So, just imagine a client with chronic illness and on bed rest, okay, without having exercise. You can see there that joints, okay, may become permanently flexed, or you can see a contracture. So, as you can see in this image, right, the other small finger is shorter compared to the other one. In terms of joint mobility, we have the practice of range of motion. So, as I have mentioned to you, when we say range of motion here, we move our extremities, okay, we move the joints, we flex, okay, we extend, we adduct, okay, and many more. However, the range of motion varies and it depends on the genes or genetic makeup of your client. So, you have to check through interview, okay, the genes, and then also check the developmental patterns or the age group. And then, is there presence or absence of any disease that can limit the client to do the range of motion? How about physical activity? Is the client engaged with physical activity? In terms of balance, okay, the mechanisms involved in maintaining balance and posture are actually complex. And it involves informational inputs from the inner ear or the labyrinth, okay, also the vision, from vestibulo-ocular input, and stretch receptors, okay, of the muscles and tendons, which is the vestibulospinal input, which again involves your muscles and tendons. How about the coordinated movements? Okay, so when we say coordinated, it's the movements again are balanced, it's smooth, it's purposeful. Okay, you're not the client is not sluggish, and again, there's coordination of movement. This results of because of the proper functioning of the cerebral cortex, which initiates the voluntary movement, cerebellum, which coordinates the motor activity, and the basal ganglia, which maintains the body posture. Okay, so what are the factors affecting the body alignment and activity? We have growth and development, personal values and attitudes, prescribed limitations. We also have nutrition, external factors, and exercise. So, let's see. In terms of growth and development, okay, we can see here the differences. Among newborn, okay, their movement, again, is actually, their extremities are generally flexed, if you can see them. But they can be passively moved through a full range of movement or motion. Okay. In terms of among 1 to 5 years old, there is already a refined gross and fine motor skills. Example, preschoolers can ride a tricycle. Okay, they can also jump. They can also use crayons. What else? Among 6 to 12 years old, of course, they have refined motor skills. The exercise patterns for latter life are generally determined. Among adolescents, you can notice the growth spurts, okay? However, okay, we have here poor posture. Okay, maybe it is associated with carrying of heavy bags, heavy loads, all right? Another one for adults, ages 20 to 40 years old, you can only note a few physical changes, okay? Among older adults, there you can see some changes where there's decreased bone density, the ability to be flexible, their bone mass characteristics, and you can notice osteoporosis where there is brittle bones. Okay, now let's have nutrition. Are you familiar with the 10 commandments of the Department of Health and the National Nutrition Council and FNRI? Okay, so what we can see here is that again, body alignment and activity can be affected in terms of poorly nourished client or individual because it can result to muscle weakness and fatigue. How about vitamin B deficiency? Okay, when you are deficient in vitamin B, then you can develop easily bone deformity or osteoporosis. How about those who are obese? Okay, if an individual or a client is obese, you can check the movement of that client. Are the movement distorted? Okay, is there any complaint on joint pain? Because again, obesity is the reason for that one. Next, we have personal values and attitudes. So, family influences, again, the children's lifestyle. So, sedentary families, again, they watch TV, play computer, they are just at home without any activities. With this kind of living or way of living, then they might influence their children. Another one is physical appearance. Do they again take note of their physical appearance, like their proper grooming? And then another one for the choice of physical activity, this varies in terms of the location or cultural role. For example, those living in rural areas, they tend to walk more, jog, run, okay, do hiking compared to those in urban areas like, for example, in NCR, in Metro Manila, where instead of walking or running outdoor, most of us do that in some facilities like the gym. Okay? Another one, we have external factors. So, take note that excessively high or hot temperatures and humidity, okay, discourages activity. So, that makes an individual, again, prefer to stay at home. Okay, so also the availability of recreational facilities can influence the activity. Like for example, you don't have any budget or you lack money, okay, to join a club or enroll in a exercise therapy or go to a gym, okay? So, then we also have safe neighborhood. So, if the neighborhood is safe, then it can promote outdoor activities. Next is prescribed limitations. So, limitations to movement may be medically prescribed for some health problems. Like, for example, those on bed rest, like they have hypertension, they are on strict monitoring. Okay. Another one, those with limitations are clients with surgical casts, splint, okay, braces in the, on the body, cane, and so on. And we have here exercise. So in terms of exercise, actually individuals participate in exercise programs to decrease risk factors for chronic diseases and be able to improve their health and well-being. If the type of exercise is functional, it's more focused on strength. So, it describes more of the ability of the body to perform work. Okay? Activity tolerance, on the other hand, is the amount of activity that can be performed without any adverse reactions or adverse effects. Okay, just remember that their frequency and duration for adults to perform exercise is that it takes 150 minutes, per week, or 75 minutes vigorous intensity aerobic, or can have an equivalent combination of moderate to vigorous intensity activity. Okay, so have you ever wondered the types of exercises? Okay, so we have here the isotonic or dynamic exercise. So, muscles shortens to produce muscle contraction and active movement. This one, it increases muscle tone, mass, and strength, and it maintains joint flexibility and circulation. So, for the reaction of heart rate and cardiac output, they increase, and with that, it increases the blood flow. Next is the isometric or the static or setting, So here, there is muscle contraction without moving the joint, as you can see in the image. So the muscle length does not change. It involves exerting pressure against a solid object. So it produces a mild increase in heart rate and cardiac output. There's no apparent increase in blood flow to other parts of the body. So that is isometric. Next is isokinetic or resistive exercises. Here, there's muscle contraction or tension against resistance. It can be isotonic or isometric. But take note here that the person moves or tenses against resistance. And it can increase the blood pressure and blood flow to muscles. Aerobic exercise. Okay, so this one's an activity during which the amount of oxygen taken into the body is greater than that's used to perform the activity. Okay, so have you ever experienced joining a Zumba class? Okay, so that's an aerobic exercise. So it improves cardiovascular conditioning and physical fitness. Anaerobic exercise, on the other hand, is an activity in which muscles cannot draw enough oxygen from the bloodstream. Anaerobic pathways are used to provide additional energy for a short time. It's used in endurance training for athletes. As you can see, weightlifting is an example of this one. What are the benefits of exercise? So, for the musculoskeletal system, it maintains the size, shape, tone, and strength of muscles, including the heart muscle. It enlarges the muscles, or we call that hypertrophy. It nourishes the joints. It increases joint flexibility, stability, range of motion. Maintains bone density and strength. For the cardiovascular system, it increases the heart rate. It's as well as the strength of contractions, blood supply to heart and muscles. Again, this can mediate harmful effects of stress. For the respiratory system, it increases ventilation and oxygen intake. So, it improves gas exchange. Okay, just like, for example, here we have the deep breathing exercise wherein you breathe in for 4 seconds and then hold breath for 7 seconds and then exhale for 8 seconds. Okay, so that's according to the Department of Health. So, this one, the exercise prevents pooling of secretions and this again can be found in bronchi, bronchioles. How about the GIT? For the gastrointestinal tract system, it improves appetite. It increases the GI tract tone. It facilitates the peristalsis or the movement in the GIT. For the endocrine system and metabolism, it elevates the metabolic rate. It helps reduce serum triglycerides and cholesterol. Okay, we don't want that. So that predisposes an individual to hypertension. And then it also stabilizes blood sugar, okay, and makes cells more responsive to insulin. Therefore, it prevents, okay, correct, it prevents diabetes mellitus. For one's immune system, whenever you exercise, okay, you can observe for pumps in lymph fluid from tissues to lymph capillaries and vessels, meaning to say there's increase in circulation through lymph nodes. So, strenuous exercise may reduce immune function and leaving windows of opportunity for infection during recovery phase. So, take note of that when you do your health teaching. In terms of the psychoneurologic system, it elevates the mood. It makes one individual happy. Okay? It can relieve stress and anxiety. It develops relaxation response. It improves quality of sleep for most individuals. For the cognitive function, it has positive effect on decision making and problem-solving processes, planning, and focus or when you pay attention, okay? It induces cells in brain to strengthen and build neuronal connections. In terms of assessment, we conduct in nursing history or an interview. So, have a checklist that, again, you can ask about the activity and exercise pattern of your client and discuss any problems in terms of activity and exercise or body movements. In terms of physical examination, you take note of the client's body alignment, posture as well, and when you do your PE3, where you can ask the client to do ROMs, then you can check as well any difficulties in terms of the movement of the joints. So that could be in terms of flexion, extension, abduction, adduction, okay. For diagnosis, of course, we can refer to NANDA, okay, and then check again your client's condition. If it is mobility-related problems, some of the sample diagnosis statement here could be inadequate physical energy for activities, potential for inadequate physical energy as well, altered physical mobility, inactive lifestyle, and you can notice decline in health. Whenever you do your planning, of course, you must consider setting goals and objectives. So, in terms of activity tolerance, then you can check the body positioning, okay, bowel elimination, fall prevention behavior, immobility consequences, both physiological and psychocognitive. Okay, so there you can develop outcomes. For the implementation, maintain or promote body alignment and mobility. So that includes proper positioning of the client, regular moving and turning of the client in bed, so as ordered, or usually it's like every 2 hours. But then again, it depends on the on the doctor's order and the condition of the client, all right? And then proper transferring of the client. So proper transferring from perhaps from stretcher to bed or vice versa. And then you provide range of motion exercises only if the condition permits, okay? So, for evaluation, again, the goals established during the planning phase are evaluated according to specific desired outcomes. And then, if outcomes are not achieved, then the nurse or student nurse, okay, together with the client and support person, okay, can explore reasons before modifying the care plan. Next topic is nutrition. For the learning outcomes, at the end of this discussion about nutrition, the students will be able to define key terms on nutrition, describe nutritional variations throughout the life cycle, enumerate factors affecting nutrition, identify various special diets, and explain nursing care management on altered nutrition. So when we say nutrition, it is actually adequate food intake, okay, that consists of a balanced nutrients, okay. So it is the sum of all the interactions between an organism and the food it consumes. Nutritive value. Have you seen a nutritive value? So that's part of the food that you buy, okay, it's in the packaging. So there you can take note of the nutrient content of specific food, okay. It's specified the kilocalories, the nutrients, okay, that you can get from eating that food. And then when you say nutrients, it's organic and inorganic substances found in foods that are required for body to function. So, here are essential nutrients, okay. We have macro and micro. When we say macronutrients, okay, we have water, carbohydrates, protein, fat, minerals, and vitamins in 100 grams, okay. Water is the most basic nutrient needed by our body because every cell requires continuous supply of fuel and the most important nutritional need. So, after water is the food that provides energy together with these macronutrients, okay? On the other hand, micronutrients are those with vitamins and minerals that are required in small amounts to metabolize the energy providing nutrients. Okay, so when we say carbohydrates, okay, carbohydrates are composed of the elements carbon, okay, so that's C, and hydrogen and oxygen. So this is a major enzyme, thiolene, okay, the salivary amylase, pancreatic amylase, and disaccharides. So it's the end product of the monosaccharide. It's normally absorbed by the small intestine. In terms of metabolism, the body breaks carbohydrates into glucose, okay? And then maintains blood levels, and it provides the source of energy. And in terms of storage and conversion, it can be used, or if not used, then can be stored as glycogen or fat. Okay, again, it can be used or stored. So, take note. So, if it is not used, then it will just get stored as fat. Alright? How about proteins? Proteins are essential amino acids. Okay, it cannot be manufactured in the body Okay, so we have, in terms of its digestion, digestion begins in mouth with enzyme pepsin. Most protein are digested in the small intestine, and then the pancreas secretes the proteolytic enzymes trypsin, and then the chymotrypsin and carboxypeptidase. Okay, so glands in intestinal wall secrete we have the aminopeptidase and dipeptidase, which can then break the protein into amino acids. In terms of its metabolism, we have anabolism, where it involves the building of the tissue, okay, catabolism, breaking down of the tissue, and then for the nitrogen balance, there's degree of anabolism and catabolism combination for the balance. It can be, absorbed by active transport through small intestines. Okay? Next, we have lipids. Lipids are organic substances that are greasy and insoluble in water but soluble in alcohol. Okay? So, fats are solid at room temperature. Have you noticed that one? Fatty acids, we have saturated or unsaturated. Saturated, carbon atoms, filled to capacity with hydrogen. We have example butter. Unsaturated could accommodate more hydrogen atoms. Okay. In terms of cholesterol, lipids, produced again can be found in the body. So both can produced by the body and can also be found in foods, of course, if it is animal product. And then it can be synthesized in the liver, and there's a need to create bile acids and synthesize steroid hormones for this one, for the cholesterol. In terms of its digestion, small intestine and liver convert this lipid into soluble compounds. We call that the lipoproteins. And in terms of the metabolism, conversion of fat into usable energy, through enzyme lipase. And then break down triglycerides in adipose cell, releasing glycerol and fatty acids into the blood. Next, let's have micronutrients. So, micronutrients in terms of vitamins. So, here we have organic compounds. They are needed to catalyze the metabolic processes. So, water-soluble, they are vitamins C and B complex, and they are needed daily. So, water-soluble means that it can be, it cannot be focused on being stored in the body. You can eliminate it, It cannot be staying in the body. It's water soluble. There are vitamins that are fat soluble, So that's the difference from vitamin C, which is water soluble, Vitamins that are fat soluble are we have the ADEC, ADEC. So, vitamins A, D, E, and K. So, meaning it can be stored in your body. Alright? And then we have minerals, macrominerals and microminerals. So we have calcium, phosphorus, magnesium, chloride, and sulfur. Microminerals, iron, zinc, manganese. You also have iodine, fluoride, copper, cobalt, chromium, and selenium. Next is the nutritional variations throughout life cycle. We have neonate to 1 year. Nutritional needs include breast milk or formula. You only feed the neonate, when hungry or as per demand. The total nutritional requirement of newborn is 100 ml of breast milk or formula per kilograms of body weight. Regurgitation, is a normal occurrence, okay? You can also observe for iron deficiency as you check the lab test, okay, that again, it is caused by inadequate supply of iron. Therefore, it is recommended that neonates or newborns should be exclusively breastfeed for 6 months until 1 year as desired. Next, we have toddlers. So, toddlers eat most foods. They actually have 3 meals per day. They feed themselves, okay? They have deciduous teeth, okay? And that allows them to take different kinds of food. Preschoolers can take adult foods. They can also ask for snacks, of course. And then among school age, they actually have balanced diet of about 2,400 kilocalories. They need protein-rich food for breakfast to sustain schoolwork. And then at this rate, you teach the child about healthy eating habits, okay? So that they won't get obese. Next, we have adolescents. So, they have increased need for nutrients and calories. So, as well as calcium. So, you teach healthy lifelong eating habits. There can be also experiences where they have either anorexia nervosa or bulimia. So, anorexia nervosa is a prolonged inability or refusal to eat. So, there's rapid weight loss and there's also emancipation in individuals with anorexia. So next is we have here bulimia. So in bulimia, there's uncontrollable compulsion to consume enormous amount of food and then they expel it by inducing vomiting or through taking laxatives or purge. Young adult, on the other hand, they continue to eat a healthy diet with special attention to protein, calcium, and limiting cholesterol. Okay. Okay, and caloric intake. So, as not to gain weight. So, 2 or 3 liters of fluid should be included in the daily diet. Next, we have the middle-aged adult. So, there's postmenopausal women, okay? They need to ingest sufficient calcium and vitamin D to reduce osteoporosis. There's also a need of antioxidants such as vitamin A, C, and E. It might be helpful, okay, in reducing the risk of heart disease in women. Older adults, on the other hand, they require fewer calories, okay, because of their slower or lower metabolic rate. Physical changes may affect eating habits. And then other psychosocial factors can also affect eating habits, like whenever they live alone or they have poor access to stores. So, here for the standards of for a healthy diet, okay, various daily food guides have been developed to help healthy individual meet the daily requirement having essential nutrients. So, there's development of food guides, dietary guidelines for Americans. We also included here nutritional guidelines for Filipinos. So, for the dietary guidelines for Americans, it's published by the USDA every 5 years. They actually shift to plant-based food, and then they reduce foods with added sugars, fat. They included their regular exercise and encouraging consumption of foods with vitamin D, calcium, potassium, and fiber daily. So, as been emphasized, they keep fat to 20 to 35% of total calories. And then, less than 7% of saturated fatty acids per day. Less than 300 milligrams of cholesterol per day. Consume less than 1,500 milligrams of sodium per day. And in terms of alcohol, moderate intake is, of course, recommended. For their they have This one, My Plate, it's introduced by the First Lady Obama in 2011. So, this plate, okay, or myplate.gov, when you enter the site, it will suggest, okay, foods necessary according to your age, to your weight, to your BMI. So, it promotes getting more fruit, vegetables, whole grains, low-fat dairy foods. Okay, and then as I have mentioned to you, the food plan is personalized based on your age, your sex, your height, weight, your physical activity level. For the Filipinos, we have the nutritional guidelines, okay? I have mentioned a while ago that 10 kumain means, okay? 10 kumain means, ayan. Okay, so it is a popular version of the revised nutritional guidelines for the Filipinos. So this is shorter and simple and more helpful to everyone. So number one here, 1 out of 10, eat a variety of food every day to get the nutrients needed by the body. And breastfeed infants exclusively from birth up to 6 months. Then give appropriate complementary foods while continuing breastfeeding for 2 years and beyond for optimum growth and development. Next is to eat more vegetables and fruits every day to get the essential vitamins, minerals, and fiber for regulation of body processes. And then consume fish, lean meat, poultry, egg, dried beans, or nuts daily for growth and repair of body tissues. And then consume milk products, and other calcium-rich foods such as small fish and shellfish every day for healthy bones and teeth. 6. Consume safe food and water to prevent diarrhea and other food and waterborne diseases. 7. Use iodized salt to prevent iodine deficiency disorders. 8. Limit intake of salty, fried, fatty, and sugar-rich foods and beverages to prevent cardiovascular diseases. 9. Attain normal body weight through proper diet and moderate physical activity to maintain good health and prevent obesity. And 10. Be physically active. Make healthy food choices. Manage stress. Avoid alcoholic beverages and do not smoke to help prevent lifestyle-related non-communicable diseases. Okay, next, let's take a look at the Pinggang Pinoy. Okay, so the Pinggang Pinoy consists of grow, glow, and go foods. So here it's recommended for adults age 19 to 59 years old. So go foods are energy-giving foods. We have here rice, root crops, pasta. There's recommendation here that you choose whole grains, okay, and it's because it's linked to lower risk for heart diseases, diabetes, and other health problems. And then grow or bodybuilding, you eat fish, shellfish, lean meats, okay? And then consume milk products. Just what's being mentioned a while ago in the 10 kumain means as well. For the glow or body regulating, you enjoy a wide variety of fruits and vegetables which are packed with vitamins, minerals, fiber needed for the regulation of body processes. And drink lots of water. Okay, so drink water instead of sugar sweetened beverages to reduce the risk of obesity and what else? Tooth decay. And again, don't forget to eat less salty, fried, fatty, and sugar-rich foods. Okay, to prevent chronic diseases. Okay. I have here a sample one-day meal plan for your reference, okay? So, in terms of diagnosis, altered nutrition, okay, we have malnutrition. Malnutrition, take note, includes both undernutrition and overnutrition. Malnutrition is the lack of necessary food substances in the body. Okay, when you say overnutrition, okay, you have caloric intake in excess of daily energy requirements. Okay, so we have this here, overnutrition, particularly overweight. Okay, on the other hand, overweight, here there's increase in the amount of stored fat. Okay, as you can see in the image. Okay, so the BMI is between 5 and 29.9 kilograms per square meters. And then, whereas if you compare it with obese, their BMI is greater than 30 kilograms. Okay, that's big enough. A while ago, we've mentioned again, part of malnutrition is undernutrition. So, undernutrition is having insufficient intake of nutrients to meet the daily energy requirements. So, as you can see in the image, it's marked with weight loss. Ayan. Okay, protein, calorie malnutrition, there is depressed visceral proteins, weight loss. Here, you can see in the image, there's visible muscle and fat wasting. Alright, so in terms of assessment, okay, you can conduct data collection through interview, and then also you can ask for the 24-hour food recall. Some may require a 3-day diet food recall. Just take note that, again, when you say 24-hour food recall, you take note of the food consumed within 24-hour period at home, okay? And also, you take note of the food intake frequency record, and also ask any preferences, food habits, okay? That's going to be part of the diet history. In addition, also you can conduct measuring the skin folds or the mid-arm circumference. So, we call that the anthropometric measurement. So, it aims to quantify the body composition. So, if for example, you're going to measure the skin fold, okay, so this determines the fat storage. So, for the mid-arm circumference, okay, that one will measure the fat, muscle, and skeleton. So, you make use of a you make use of a measurement here, okay, for you to be able to find an estimate lean body mass, okay. Another one, you can review the biochemical or laboratory data. For serum protein, provide an estimate amount of visceral protein that's being stored. So, for example, albumin, there's low value, okay? So, it indicates prolonged protein depletion. So, transferrin binds and carries iron from the intestine through the serum, and it can be measured, okay, through the total iron binding capacity. So, if there is low value in terms of the hemoglobin or iron, then that indicates iron deficiency anemia. Another one is urinary test, okay? Urea concentration in the blood and urine reflect the intake and breakdown of the dietary protein. Also, you can see the production of urea in the liver and the rate of that the urea can be removed by the kidneys. Urea is the chief end product of amino acid metabolism. In terms of diagnosis, here are some statements that you can You can check in NANDA. Of course, you must relate it with the client's condition, okay? So, check out the etiological factors. We've got obesity, excess dietary intake, insufficient dietary intake, overweight, okay? In terms of planning, okay, maintain or restore optimal nutritional status, promote healthy nutritional practices, prevent complications associated with malnutrition, decrease weight, or of course have a normal body weight, and regain specified weight, which is a normal body weight. Next is monitor the client's appetite and food intake in terms of the implementation or implementing, okay? And then administer enteral and parental feedings as prescribed. And then consult with primary care provider and dietitian about any nutritional problems. Should there be a need for special diets, okay? During the implementation, you take note of various special diets, depending again on the client's condition. We have clear liquid diet. So, in clear liquid diet, okay, we have fluids and carbohydrates. So, there's no adequate protein, fat, vitamins, minerals, and calories. It's different from full liquid diet in a way that full liquid diet consists of liquids or foods that turn liquid at body temperature. So, full liquid diet is being given to clients with gastrointestinal tract disturbances. So, take note of the sample full liquid diet here. In terms of the evaluation, okay, again, if the outcomes are not achieved, the nurse should explore the reasons. So, what could be the cause of the problems identified? Are the outcomes realistic? Okay, were the families included? Are they supportive? How about the client's preferences? Is it considered? And do symptoms cause loss of appetite? Alright, so again, take note of anything that interferes with digestion or absorption of nutrients. And for the last topic, okay, in this discussion, we have sleep. For the learning outcomes at the end of discussion, the students will be able to explain the physiology of sleep, identify variations of sleep patterns throughout lifespan, enumerate factors that affect sleep, and describe common sleep disorders and interventions. So, when we say sleep, okay, an individual has an altered state of consciousness. So, it is the perception of an individual and that the reaction of this individual to the environment is decreased. Alright, so in terms of the cyclic nature, it is controlled by the lower part of the brain, where you can find the neurons and the neurotransmitters. So the neurons integrate the sensory information from the peripheral nervous system, okay, relate to the cerebral cortex. And then the neurotransmitter now, okay, located within the neurons in the brain affect the sleep-wake cycle. The neurotransmitters are serotonin, gamma-aminobutyric acid or GABA, acetylcholine, dopamine, noradrenaline. Serotonin is thought to lessen the response to sensory stimulation. GABA is thought to shut off activity in neurons of the reticular activating system. And acetylcholine, dopamine, noradrenaline, okay, is associated with cerebral cortical arousal. Okay, so when there's darkness and practice of sleep rituals, it is caused by a decrease in stimulation of the RAS, and then the pineal gland begins to secrete melatonin, and the person feels less alert. Okay, and during sleep, growth hormone is being secreted and cortisol is inhibited. Okay, so what are the functions of sleep? So, as you can see, individuals with inadequate amount of sleep tend to be irritable. Okay, they have poor concentration. They also experience difficulty making decisions. So, sleep functions in a way that it can restore normal level. Okay, so the normal level of activity is being restored. So this one gives balance among parts of the nervous system. And it is important, again, sleep is important in synthesis as well as one's psychological well-being. Okay, so we have here circadian rhythm. So this one we have the biological rhythm. This is actually it's controlled from or within the body and synchronized with environmental factors. So circadian rhythm is a 24-hour internal biological clock. So example, persons awake when body temperature is at highest and asleep when body's temperature is at its lowest. Okay, so you can also notice here the types of sleep. We have the non-rapid eye movement sleep. Okay, so here when we say NREM sleep, this occurs when activity in the RAS is inhibited and it constitutes 75 to 80% of sleep. And it has 4 stages. For stage 1, okay, there's very light sleep lasting in few minutes. The individual feel drowsy and relaxed, eyes roll from side to side. The heart rate and respiratory rate drop slightly and can be readily awakened and perhaps can deny sleeping. Next is stage 2. Okay, so stage 2, there's light sleep but it lasts at around 10 to 15 minutes. The body processes continue to slow down. Eyes are generally still, heart rate and respiratory rate decreases slightly. And you can also notice that the body temperature falls. So, there's 44 to 55% of total sleep. It requires more intense stimuli to awaken the individual at stage 2, NREM, or non-rapid eye movement. Stage 3, okay, so this is the deepest stages of sleep. We call this delta sleep or deep sleep. The heart rate and respiratory rate drop to 20 to 30% below rates in waking hours. So, the individual is not disturbed by sensory stimuli, okay? The skeletal muscles are very relaxed. For stage 4, okay, the reflexes diminished. Snoring can likely happen. Swallowing and saliva production reduced. There's also essential for, again, restoring energy and releasing the important growth hormones. So these are the stages of the non-rapid eye movement. Okay, next we have the rapid eye movement sleep or REM. This actually occurs every 90 minutes, okay, of at a sleep. Then it lasts at around 5 to 30 minutes. So, there is also increase in acetylcholine and dopamine. So, most dreams take place in REM sleep. In REM, the brain is highly active. The brain metabolism increases as much as 20%. So, there's distinctive eye movements that's happening. And there's voluntary muscle tone, okay, that dramatically decreases. So, there's also deep tendon reflexes absent. Alright? So, A person on REM, okay, may be difficult to arouse or may awaken spontaneously. The gastric secretions increase, heart rate and RR are often irregular. Regions of brains, okay, are associated with learning, thinking, organizing information stimulated. Let's now relate these types of sleep, okay, into the sleep cycle. So, for the sleep cycle, okay, so actually here, the individuals typically pass through the non-rapid eye movement and rapid eye movement sleep. Okay, so it completes the cycle usually lasting about 90 to 110 minutes in adults. So, the first cycle, a sleeper passes usually through the first two stages, okay, that you can see here. These are the first two stages, all right? And then, so here, for the first two stages of an REM, a sleeper passes usually through the first two stages of this one, which is around 20 to 30 minutes, okay? And take note that stage 3 could last at around 50 to 60 minutes. Then after stage 3, the sleep passes back through the stage 2 and 3 again for over 20 minutes. Okay? And then there will be rapid eye movement, okay, which is very brief or even skipped entirely. So, so the healthy adult sleeper usually experiences 4 to 6 cycles of sleep during 7 to 8 hours of sleep. Here are the variations of sleep pattern throughout lifespan. For the newborn, okay, they usually sleep at 16 to 18 hours a day. They enter the rapid eye movement sleep immediately, and 50% is NREM or non-rapid eye movement. The other is rapid eye movement. The sleep cycle of newborn is about 50 minutes. Next, we've got infants. So, they are awakened every 3 to 4 hours, wherein they eat, and then after which they go back to sleep. So, the periods of wakefulness gradually increase, and by 6 months, most infants sleep through the night. And then they establish pattern of daytime naps. Okay, toddlers, 12 to 14 hours of sleep is being recommended. Most of the toddlers still need afternoon nap. And then there's nighttime fear and nightmares are common. Among preschoolers, okay, the child here, again, is 3 to 5 years. Okay, they need 11 to 13 hours of sleep. So the sleep needs fluctuate in relation to their activity, their growth spurts, and there's regular, consistent sleep schedule. Among school-age children, okay, so these are 5 to 12 years. So their need is actually 10 to 11 hours of sleep. That's what they need. And the factors reducing hours of sleep includes increasing demands of homework, sports or social activities. There's also increased in screen time, okay? And drinking caffeinated beverages can affect their sleeping habits. Among adolescents, they require 9 to 10 hours of sleep each night. So, there's already circadian rhythm shift. There's a tendency that they stay up later and wake in a later, okay? And then they also there's also few of them that get much sleep, depending of course on their activities. Okay, among adults, most healthy adults need 7 to 9 hours of sleep. So, the vulnerable adults are students, shift workers, or those who are at work with long hours, travelers, parents. Okay, so Among these vulnerable individuals or adults, there's a tendency that they stay up late, okay, and again, they also wake up late. For older adults, there's tendency toward earlier bedtimes and wake times. So they may show an increase in disturbed sleep. They also need to the need to sleep does not decrease with age. Okay, again, they still need to sleep, just like adults do. However, there are conditions that may predispose them to have shorter sleeping hours, which is actually not recommended, and it's not healthy. Okay, so here are the factors affecting sleep. One, we've got illness. Okay, example, respiratory conditions. It can show or this shows shortness of breathing as one of the symptoms. Another one, gastric or duodenal illness or ulcers. There's pain, okay, and this pain is associated with the result of gastric secretions. And you also have here the endocrine disturbances or elevated body temperatures. Example, hyperthyroidism lengthens pre-sleep time. And then the increased body temperature causes in reduction of delta or deep sleep and rapid eye movement. Okay, next we have the environment. Okay, the environment can affect one's sleep. So environmental changes such as noise. Okay, what else? Also the temperature, the light levels, it can affect or either promote or hinder one's sleep. So any discomfort from the temperature, okay, for example, humid, hot temperature, this again inhibits sleep. And then the in terms of light levels, example, the client is accustomed to darkness, so when you leave the lights on in the hospital, they may find it difficult to sleep because they are accustomed to darkness. Another one is lifestyle. Okay, so irregular schedule. So individuals or clients with irregular schedules, such as those on night shift, okay, as their work, they have difficulty falling asleep. Okay, and again, the change in the schedule can affect their sleeping habits. Another one is having a late exercise in the day. So, morning or early afternoon exercise is recommended to again be more conducive for one's sleep. How about emotional stress? Okay, so this is the greatest cause of difficulty falling asleep. Anxiety increases the norepinephrine blood levels. Okay, and then through stimulation of the sympathetic nervous system, there will be less deep and rapid eye movement sleep. Okay, so how about caffeinated drinks? Okay, if you are fond of drinking caffeine before bedtime or even in the afternoon, then again it might inhibit sleep, or the client may have difficulty sleeping. Again, caffeinated drinks acts as a stimulant of the central nervous system. And then this will again disrupt the rapid eye movement sleep, and the same thing, alcohol as well can disrupt sleep. And once disrupted, the individual or the client may become irritable. How about the diet? Okay, so weight gain is associated with reduced total sleep time. So weight loss is associated with an increase in sleep time. So meaning to say, some individuals, some clients tend to eat more in order for them to be awake or to stay awake. And that makes them gain weight. Alright? If the client is having a hard time sleeping, okay, especially children, taking milk before bedtime is recommended because again it may induce sleep because of the dietary L-tryptophan that can be found in the milk, can also be found in cheese. Okay, another one is smoking. So this smoking again, it has the nicotine content, okay, which stimulates, which is being again stimulating, and it inhibits sleep. So usually smokers are light sleepers. Okay, next we have motivation. So a person with too much or high motivation can actually have a sleep which is being affected by this condition. So there'll be an increase in alertness, and usually not sufficient to overcome normal circadian rhythm. Like for example, just like you, student nurses, you are motivated to finish your nursing care plan, your nursing process, and you want it you wanted it done, okay, at once. So you'll end up, spending the night doing that instead of sleeping. Next, we've got medications. So, medications, its effect could again influence or affect one's sleep. Like for example, hypnotics or hypnotic drugs, it can interfere with the deep sleep and suppress the rapid eye movement. So, beta blockers can cause insomnia and nightmares. Narcotics, okay, like morphine, they can cause frequent awakenings. And then the client, as you can see, they are drowsy. And then tranquilizers, they're given to, for example, depressed clients. Alright, there might be rapid eye movement rebound where the individual would increase in sleep. Okay, so here are common sleep disorders. So we have insomnia. Insomnia is the inability to fall asleep or remain asleep, where it is recognized by waking up frequently, difficulty staying asleep, there's daytime sleepiness, and there's difficulty concentrating. Hypersomnia, on the other hand, is having a sufficient sleep at night but cannot stay awake during the day. It may be caused by medical or psychological disorder. So, next we have narcolepsy. So, it is caused by lack of hypocretin in the central nervous system that regulates sleep. So, here, the clients usually have sleep attacks. Okay, and then they sleep at night, but it usually begins with sleep onset of rapid eye movement. How about sleep apnea? Okay, so this here you can take note of the client with frequent short breathing, and this breathing pauses during a sleep. So the symptoms could include snoring, frequent awakening, difficulty falling asleep again, morning headaches because of the lack of sleep, memory and cognitive problems, irritability because of the lack of sleep. Okay, parasomnia is the behavior that may interfere or which occur during a sleep. So there is arousal disorder, sleepwalking, sleep paralysis, and it's associated with nightmares. In terms of assessment, you can conduct again history taking through interview. So you can ask the client, when does the client usually go to sleep? What time? Are there bedtime rituals? Does the client snore or have been told that they actually snore? Can the client stay awake during the day? Okay, are they taking any prescribed or over-the-counter medications to induce sleep? Okay, so you can review the client's sleep diary, or if they don't have, you can ask the client to record their sleep pattern. Okay, this again can help the client keep track of the time factors associated with sleep, activities performed 2 to 3 hours prior to sleep, any consumption of alcohol, caffeine, any medications. You can, of course, conduct physical examination. So, physical examination rarely yields information unless client has obstructive sleep apnea. And then what else? What you can observe: enlarged and reddened uvula and soft palate, enlarged adenoids and tonsils, obesity. Okay, so there. Next, you have the polysomnography, where actually this is actually either conduct of electroencephalogram or electromyogram or electrooculogram, where they're common, okay, common characteristic of this diagnostic procedure or study is that an electrode, okay, is placed in the head of the client, and the electrodes transmit electrical energy from the cerebral cortex and muscles of the face to pens that record the brain waves and muscle activity on graph paper. So this requires an expert, of course, to do this one, and of course, doctor's recommendation. For diagnosis, we have inability to sleep, and in terms of outcomes, that the client will develop a sleeping pattern, okay, which provides sufficient energy for daily activities. For the nursing diagnosis of difficulty falling asleep, outcomes that we look forward to is that the client will improve the quality and quality of his or her sleep. In terms of the implementation, okay, so again, we carry out or we teach the client about interventions related to sleep hygiene to promote sleep, and then we teach the client on how to promote sleep, like creating a restful environment. We promote comfort and relaxation, and then should there be any medications, then we check it, of course, with the doctor's order. In terms of evaluation, based on the data collected and the desired outcomes from planning stage, the nurse again judges whether the client goals and outcomes have been achieved. If not, okay, the nurse and the client should explore the reasons and modify the nursing care plan. Here are the references that I've used. So we have your Fundamentals of Nursing, particularly chapters 44 to 46. Okay, and then we have various government sites. Okay, and again, you can visit or take a look at your reference for more information about our discussion or about the concepts that we discussed. So, before we continue with the second part of our discussion, don't forget to take the practice quiz. Again, this is Dr. Judith Sugay saying thank you, maraming salamat po, and I'll see you again on the final part of our discussion.